From the ongoing pandemic to continued tension around race relations in America, day to day and sometimes really hour to hour can feel turbulent for us. That can take a big toll on our mental health. So let's do a little mental health checkup, shall we? Brad Schwall from the Center for Integrative Counseling and Psychology in Dallas is here with us this morning. Good morning. Good to see you.
Good morning. Good to see you.
So, I took a little social media and mental health break last week, and I thought, yeah, this will be okay, but it was like really nice. What are you telling? Oh my gosh, it was like night and day. So what are you telling people? And I know we say this a lot, like take a break from social media. What does that mean?
Well, I do believe that it is true that crisis and challenge can lead to opportunity. So whether we're talking about social media or not, being constructive in acting, taking action to learn about what's happening, learn about racism, and finding ways to get involved. That way we are turning our stress or our grief into action that can actually help our community. I went to a prayer rally on Sunday, and it was fantastic to hear ideas for specific ways to contribute.
And I guess I mentioned social media, Dr. Schwall, because it feels so pervasive right now. You know, that's just how people are connected and communicating in the absence of actually gathering and seeing each other in a lot of cases. But also it's like people you don't know and sort of, the keyboard warriors, we call them, right? People saying whatever they want to say, a lot of ignorance and a lot of hate. And so how do we digest that just as people?
Right. So important to be discerning about our social media diet. And I think it is important to make sure that we're modeling respect, for one, then also monitoring what we are exposing ourselves to, and then find good information. So in the news, talking about the fact that racism is a public health issue. Mental health is a health issue. That systemic issues related to racism and poverty make mental health care access difficult, and we need to be focused on how mental health does relate. Also, with police reform, getting social workers involved to help in calls that involve mental health. So as far as social media goes, watching what we communicate, watching what we take in, and doing our best to be a part of the solution and to see where mental health does relate to all that is happening. And most importantly, taking care of ourselves, recognizing when we are stressed to be able to manage that.
Yeah, and ways to take care of yourselves. I know that we've talked a lot about this. Exercise, going outside, taking a walk, spending time in nature, meditation, reading a book. The list goes on and on. So
it does. And there's more and more challenges that we have to respond to, for sure. And recognizing that right now, the focus can be on empathy. Racism leads to trauma. Racism leads to stress. What we are witnessing leads to trauma and stress. So I think one key word now is that self-care, but also that empathy for others.
Okay, Dr. Schwall, thank you so much for your time. We appreciate it.
Thank you.
Okay.